Good day, my name is Jürgen Steinmetz from Itoba News and Hawaii News Online. Today, the State of Hawaii Department of Health released a statement that the new, more severe Delta version of the COVID virus is now on all Hawaiian islands or counties in Hawaii, what includes Oahu, Maui, Kauai, and Hawaii Island. This is concerning. The virus is spreading, and I attended a press conference today where health officials are explaining what to expect and what this virus is doing to those that are vaccinated and not vaccinated. Please listen in.
And the remainder were on Oahu, but as you know, you may recall that previously we had a case on the Big Island of Hawaii. So now all of the cases, all of the counties in Hawaii have had cases of this B1617.2, the Delta variant. For the batch of 45 that we tested yesterday, these were community samples. 9 of the 45 were the Delta variant. So this is 18% or so. So this is a growing percentage of our cases due to the Delta variant. We also had some of the earlier known strains going about, the UK strain, the Alpha variant. We had 11 of those. And the Gamma variant, or the P1 or Brazilian strain, we had 11 of those. But I think what's the big concern is the rapid growth in the percentage of our cases that are due to this new Delta variant.
Thanks, Ed. Shall I pick it up from here?
Yes, please.
Okay. You know, each time we've detected a new variant in our state, I think all of us feel a surge of concern and maybe anxiety. And then we in the health department get the question, what do we need to be concerned about, or how concerned do we need to be, or what should we worry about? And the Delta variant is actually one that is even more concerning, although for similar reasons, than some of the other variants. It appears to be much more transmissible, even than the earlier variants that were also more transmissible than the original strain. And it's also the first one for which we have some preliminary indication that it may cause more severe disease. So obviously, when we have a virus that spreads more easily and can make people sicker, those are real reasons to be concerned about this virus and about keeping it under control in our community. In contrast to where we were, 6 or 8 months ago, we have really good news about this variant, which is that even though it's probably the most concerning one we've detected, it is still very much prevented by the available vaccinations. So we know none of our vaccines are 100%. But people who are fully vaccinated are much less likely to become sick with any of the variants, including the Delta variant. They are also, even if they do become sick, as some people will, if you're fully vaccinated, you are very unlikely to have severe disease or need to be hospitalized. And you're also much less likely to transmit that virus to other people, even to people who live with you in your household. So to me, the answer to the question of should we be worried is yes, we should be worried about this virus, and it is spreading quickly in our state as we expected it to do. But we can take that worry and move it into action to really effectively slow that spread and protect all of us. And that's by getting vaccinated if we haven't already been.
Thank you, Drs. Desmond and Behrman, for the opening remarks. And now, if we can, we'd like to open it up to questions from the media. And I probably don't need to go through about how to do it because you've all been so terrific. If you have a question, chime in. Please take turns. Follow-up questions are, of course, allowed. And if you're having trouble getting in, please raise your hand, and I would be happy to call on you individually. But first question, who's got a question? Jen,
I've got a question.
Sure.
Sorry for the noise here. They're doing construction on our new studio. But I see that this is alarming, but how exactly is this being introduced into the state? It says here on your press release, 7 or 8 separate introductions into the state. If we're doing all of this testing requirements for visitors coming in, and, all of us islanders who are traveling need to be vaccinated in order to come home, how is it getting here?
Well, I can speak to that, Jen. I mean, we know that a single test 3 days before you travel here is not is not 100% guarantee that you won't bring disease into the island, because the disease has an incubation period of 2 to 14 days. So if you're tested 3 days before you travel and you get exposed after that, your test will be negative, but you can still be exposed before you travel here on vacation or come home here if you've been away on vacation and introduce disease into our state. And because I'm the district health officer on Kauai, where with a few exceptions, including recently, almost all of our disease has been directly or indirectly introduced as a result of travel. That's precisely the type of scenario we're seeing, that people are being tested before they travel. That test is negative and is legitimate and is real, but they have been exposed, or they become exposed shortly thereafter and then become sick when they're here. So the only way for virus to get to our state, or new viruses to get to our state, is by travel, either by returning residents or by visitors. But then once it's here, especially with this very highly transmissible Delta variant, then it can spread within our community without any additional travel.
I just have one thing that I'd like to add to that. Of the 13 cases we've had so far, 7 or 8 have been imported cases, and they're not related to any other cases here in the state. Unfortunately, I think that pattern is going to change, that now that it has been introduced here, the Delta strain will be spread within our state. And then in the future, most of the cases we see will be the results of community transmission. So the way to prevent that, as Dr. Behrman has said, is to get vaccinated.
And actually, Ed, that's another good reminder that if people are feeling sick, especially if they've traveled recently or they think they may have been exposed to a case, we certainly recommend that they get tested. And testing is widely available on all of our islands.
Jürgen Steinmetz from eTurbo News. Israel was supposed to open for tourism and made prominent announcements on July 1st. That is now postponed to August 1st. Israel has a higher vaccination rate than Hawaii. And I'm wondering, and it's setting a trend, other countries actually are following the example from Israel in that part of the world. Shouldn't we be more careful in opening our state completely to tourists under these new circumstances?
So what the governor has announced is that effective July 8th, when we think it's very likely that we will have 60% of our entire population fully vaccinated, is that people will be able to travel here from the mainland without a test if they are fully vaccinated. So it's really not opening to all tourists from all places under all conditions. It's opening to people who are fully vaccinated. And frankly, fully vaccinated travelers are the ones who pose the lowest risk to us. And we need our tourism industry for the economic well-being, which we know is really tied closely to people's health. So I think when we look at it on balance, that this remains a responsible decision, because our population will be highly vaccinated, and the people for whom we are making it easier to travel here are precisely those low-risk travelers whom we would most like to welcome, who are those who are fully vaccinated. But of course, the health department will be monitoring case counts, test rate positivity, hospitalization utilization, all of these things that we've been monitoring and tracking now for over a year, we will very much continue doing. And this is an ongoing process, and the Department of Health continues to provide guidance to the governor and the other policymakers. And as we know, COVID can surprise us and can go in directions that we don't always expect. So we are remaining, to quote the governor, we are remaining vigilant, and that's our job.
Hi, this is Stephanie at the Tribune Herald in Hilo. Were any of these new cases, were any of these breakthrough cases where the individual was fully vaccinated? And have there been any other instances of community spread of the Delta variant?
Well, I will say that among the 9 that were just reported, some of them had the same strain as previously reported cases. So that's suggestive of transmission. As I mentioned earlier, the majority of the cases we've seen so far seem to be the result of importation. But among this new batch of 9, there are some community acquired cases, yes.
Ed, I can't speak to the vaccination status of these cases. Do you know that?
I don't know if I really am entitled to comment on that.
Okay, I'm sorry, I apologize, Stephanie. I don't know the answer to that question. I only know that for the single case in Kauai County, the individual is not vaccinated, but I just don't have that information.
I guess I will say that one of the 9 cases is a possible vaccine breakthrough.
Dr. Desmond, could you explain a little bit more about the samples that you just did in the percentage? You said that 18% had tested as Delta variants. Is that a rough approximation of what percentage the Delta variant is making up, you know, the whole as a whole in terms of the variants that are spreading? And is it still a snapshot of 3 weeks ago? You had explained that during the last press conference, that there's a delay in terms of when you collect the samples and when they're tested. And if so, is there any sort of estimate that you have now as to what percentage of cases the Delta variant is now making up?
Yeah, good question. The specimens that were collected and tested in this batch of 45 that we just reported, they were collected between May 31st and June 10th. So somewhere between 3 and almost 4 weeks ago, 2 and almost 4 weeks ago. So yeah, typically it's something like 3 weeks. This is a batch of 45 community samples that was just tested and reported. So it's really a pretty small sample size to make predictions about what the percentage is of each variant. But as I mentioned, it was 9 out of 45, so that's something like 18% that we saw, but it's a very small sample size.
I have another question. Now that we know that the Delta variant is here and it's likely to spread a little bit more rapidly because it's so highly transmissible, will we be taking more samples to try to get a more accurate look at how it is impacting our community?
In the laboratory, we test about 100 specimens, 75 to 100 specimens per week. And that represents a pretty significant percentage of the positive specimens in the state. It's really enough to give us a look at the picture of the overall distribution of strains. And if we see increasing number of cases, I think we can really continue to monitor the situation and the distribution of variants with the sampling size that we have and our testing capacity that we currently have, which is 75 to 100 per week. It gives us a pretty good look at what's going on.
Jürgen Steinmetz again, eTurbo News. I'm wondering, again, I hate to just always cite other places, but I just came back from Germany a few weeks ago, and I noticed that rapid testing is available literally on every block, every street corner. You cannot enter a hotel if you're not vaccinated unless you get this rapid test, what takes 5 to 15 minutes and for a result. You cannot get into a restaurant without it. I'm not saying we should get to this type of severe situation, but shouldn't we promote rapid testing, like requiring hotels, for example, for their guests to have rapid testing every other day, so this data is up to date? It doesn't take anything to do that. I mean, it takes 10 minutes.
Well, thank you for the opportunity to plug the testing event that we're having tomorrow. We're having a free testing event here on Oahu in Waipahu, actually, at the Filipino Community Center. And it will be from 9 to noon. And the Filipino Community Center is at 94-428 Mokuola Street in Waipahu. The state has plans for expanded testing, particularly with connection to schools, and also as an attempt to make a better availability in underserved areas. So we have more widespread testing in the future. We have some efforts that are now being planned.
But
Hotel testing, I don't know.
Yeah, specifically to the visitors industry, because that seems to be the problem, is importing.
So if I could speak to that, I think it's very important to recognize that travel-related cases are not exclusively visitors and actually are generally about split evenly between returning residents and visitors. So it's a misunderstanding to look only to the visitor industry. But that said, we do look at large venues and large gatherings. And one of the approaches that's being used on Kauai is that if an organized event wants to exceed current gathering limits, in order to do so, they can collect vaccination status or testing results within 24 hours of the event in order to ensure a higher level of safety in that sort of gathering. So we haven't made the step to requiring testing, but we certainly are using it as a tool in that way. And there is more and more testing available in more sites throughout the state than there has been. Kauai has free community testing 5 days a week that's available to anyone on a walk-in basis. And I know there are similar models throughout the state.
Oh, hi, Dr. Desmond. Melissa from the Maui News. I was wondering if you could tell me a little bit more about the 2 Maui cases. Are they travel related, and are those 2 cases related?
I'm sorry, I don't have any information about the relatedness of those cases.
I have a question about the one person who may have been vaccinated that has the Delta virus. Do we know if you're fully vaccinated and you do test positive for COVID, whether you have the Delta variant, the UK, Brazilian, or whichever, are you contagious? Are you able to pass this on?
So what we know is that you are much less likely to transmit the virus to other people, but that does not mean that you cannot do so. So even if you've been vaccinated, if you test positive for the COVID-19 virus, you need to be isolated, and the health department will direct you to isolate and assist you with doing that for the full period, just the same as if you had not been vaccinated. Because although you pose a lower level of risk, you do still pose some risk. And we know that there are vulnerable people in our community.
I was wondering if we're expected to see a spike with the Delta variant case this summer, especially going into the 4th of July weekend, if you guys had any message for the people before heading into that weekend.
Well, not particularly related to the weekend, but I will say that the pattern has been on mainland USA and in other places where Delta variant has been introduced. It tends to double the percentage of cases every 2 weeks or so. So that's what I expect. That's the precedent. Right now, it's something like 18% of cases. And so I think if it follows the pattern in the mainland, then 2 weeks from now, it'll be double that.
And heading into a holiday weekend when people are going to gather, the same things that are higher risk for any strain of Delta, any strain of COVID-19 are at high risk for Delta, and Delta is going to spread even more easily. So gatherings with lots of people, especially if people are not wearing masks, especially if they're very close together or indoors or there's poor ventilation, and especially if people are unvaccinated. All of those things increase the risk, and in those settings, there will be even greater spread of the Delta variant than others. So in looking at holiday celebrations, people should be continuing to be cautious along all those lines.
Is there any indication that the Delta variant is present in the current outbreak at the Hilo jail? Have any of those samples been tested?
Yes, they certainly have, and no, it's not the Delta variant. The dominant variant there seems to be what's called the New York variant, the B.1.526.2.
Do you expect the Delta variant to become the dominant strain? And if so, when do you expect that to happen based on your projections?
Yes, and probably within a month or so.
Out of the confirmed Delta cases, do we know how many are men and women, also based on age?
We don't get that information in the laboratory. I don't have it.
Yeah, I don't have that breakdown either, sorry.
Maybe you touched on this a little bit earlier, but news out of Israel recently is that half of the confirmed cases, new cases in Israel of the Delta variant were among people who were fully vaccinated with the Pfizer vaccine. Do you guys, I know that you and other health officials have repeated that the vaccine provides good protection against the variant, the Delta variant, but is there any concern that, perhaps there's that it may not be providing as much protection as we had hoped?
Well, Sophie, I would say there's a difference between how much protection we hope or would like and how much protection is meaningful and to any given individual and to a population. So of course, we would like a vaccine to provide 100% protection against everything, but that's not true of any vaccine that we have for any disease. And all of these vaccines, even against the Delta variant, are highly, highly effective in terms of the spectrum of vaccines that we routinely use and that we rely upon to keep populations healthy. So as I said before, even if you get sick with the Delta variant or another COVID variant, and you've been fully vaccinated, your chances of having serious illness or having to be hospitalized, or even the rare case of having a fatal outcome, all of those are much, much diminished. And the likelihood that you will spread the disease to someone else is also much, much diminished. So if the choice is between a vaccine that's not 100%, but still prevents severe disease and hospitalization and spread, that seems, to me at least, to be a much better choice than no vaccine and risking disease with increased transmission and increased and possibly increased risk of severe disease.
All right, everybody. Some terrific questions and a lot of good information from Drs. Desmond and Berriman. Before we go, I give you one last chance to maybe ask some questions, and then if we want, if I can, I just talk about vaccine availability for just a minute. But does anyone else have anything else they would like to ask one of our sources of information right now? All right.
Actually, sorry, I had a quick question.
No problem.
So looking in the future with the spread of the Delta variant, is the biggest concern now to have the spread come from community cases?
Absolutely. With it having been introduced here multiple times, and we've found it now in all of our major counties. And as Dr. Desmond said, a few of these cases appear to be related or community spread. That is absolutely the concern. And I wanted to add that because of the rapidity with which this variant spreads and the rapid doubling that Dr. Desmond referred to, it's really important not only that people who haven't been vaccinated be vaccinated, but that they don't delay being vaccinated, because every additional week is a chance for this virus to take hold even more strongly in our community and spread even more quickly. So time is really of the essence in getting as many people as we can vaccinated in order to really slow the spread of this particular variant. Thank you.
And I think all of you know that the vaccines are readily available on all islands. And throughout the month of June, the vaccine is more readily available than ever before. There are interesting events happening in different locations around the state today, including at St. Elizabeth Church, where We Are Oceania is working with the Micronesian community down there today, vaccinating people. Tomorrow, there is a terrific event, that vaccination event at the Honolulu Zoo. Anyone who goes on and registers in advance can get themselves free entry to the zoo by going to the Montserrat Gate. You can find information on that by going to, you can find information on the zoo event and all events by going to hawaiicovid19.com and clicking on the vaccination link. And in particular, when we talk about the Honolulu Zoo event, because that is city property, it is a city event they're assisting with, the fire department's going to be down there assisting, we will direct you to oneoahu.org, and you will very easily see some information that will help you register for a vaccination at the zoo that is happening tomorrow between the hours of 10 in the morning and 3 in the afternoon. Hey, free entry to the zoo and a vaccine that is going to help protect you against COVID-19. What could be better than that? There's an event tomorrow at Kapolei, inline skating out in Kapolei, Wet and Wild out in Kapolei. At Waimanalo Intermediate and Elementary School, there is a vaccination clinic tomorrow, a pop-up clinic that is wide open to the public. Let's not forget that these vaccines are free. And you will find similar events happening in the coming days around the state. Boy, the Big Island has just a whole bunch of things coming up this weekend. Kona Common Shopping Center, the Prince Kuhio Plaza. You know, in Pahala, if you live in Kau or are traveling through down to Punaluu or Naalehu, you can stop in Pahala and go to the Robert Herkes Gymnasium, and there's a vaccination clinic there. At the Kona Hongwanji Mission. These are all things that are happening tomorrow just on the Big Island. So you've heard from these two people about the importance of the vaccines and protecting yourself not only against the Delta, but also against other forms and strains of COVID. And as said, if you are experiencing symptoms or if you believe you may have come in contact with someone who is infected with COVID, we urge you to please get tested. And as Dr. Desmond said, there is a free testing clinic tomorrow in Waipahu at the Philcom Center. One of the good opportunities to go out and get yourself tested. And Dr. Merriman has talked about the opportunities on Kauai as well. So unless there are any other questions, I'd like to thank you all for being here, and thank you, Dr. Desmond, and thank you, Dr. Berriman, for taking the time to share, good, solid science about something that bears watching, the Delta variant. And we will continue to update all of you as Dr. Desmond and his team continue their investigations. But you've heard them say that they expect this to become the dominant strain in the islands before too long because it spreads so rapidly. So we urge you all to protect yourselves, talk to people that you know who maybe have not been vaccinated, because we really want to push toward the 60 and 70%. And let's continue, please, to see those new case counts fall. That's what we're all headed for, fewer and fewer new cases. So thank you all for taking the time today. And one last thing. We will be announcing later today 5 new winners in the I Got Vaccinated campaign. And that will be coming shortly. You will get photographs of the new winners and their names, and you will find out what islands they are from, because they are not all here from Oahu. And so thank you for continuing to pay attention. And you all know how to find me if you have follow-up questions. Thank you all.
Thank you.